God is good.
Earlier this year, Uganda National Union of Disabled Persons Uganda commissioned a comprehensive assessment of orthopedic workshops across the country. The assessment was a follow-up of government commitments to improve rehabilitation facilities of persons living with disabilities, especially during the 2022 Global Summit on Disability.
Also had an opportunity to look at government facilities. In Kumi, for instance, there is no specific government facility for rehabilitation service provision. We have one which is now being operated by a civil society organization, but it's way out of town. And then we have a private facility, orthopedic facility in Kumi town.
During the assessment exercise, Nudipu established that most government rehabilitation units lacked adequate space and accessible designs, had staffing shortages, and lacked specialized personnel. Some had equipment which was obsolete and not well maintained, poor hygiene, and were also congested.
Among the things that came out is that we are lacking across the board. In terms of space, most of the rehabilitation units have got inadequate space for effective service provision. And partly it's because the hospital facilities are also restricted. But accessibility is generally lacking. You're lucky to find a ramp, a functional ramp, in many of these facilities.
In the recommendations, Nudipu has requested government to enhance the budgets of these rehabilitation centers and reduce their dependence on the main hospital budget.
To have a specific budget to support rehabilitation in this country. Because if we don't have a budget, then the rehabilitation centers will continue being more dilapidated, with outdated equipment and with no human resource.
They also want accessibility to rehabilitation centers improved, train personnel to manage complex cases, and have a clear database of PWDs who need access to orthopedic services.
As we speak, the database is not clear on how many people are accessing the services and where and what kind of services. So if this is not integrated, that will continue remaining as an issue, to continue training professionals, because the demand is too much.
The assessment was done in both government and private rehabilitation facilities in the districts of Kampala at Mulago Orthopedic Center, Masaka Hospital, Mbale, Jinja, and Mbarara Hospital. Private facilities included Katalemwa and Kiwa, Uganda. Susan Naung and Andrew Sebira reporting for ABC TV.